So I want to welcome everybody to today, our Lunch and Learn. This is our final session of the season for Lunch and Learn. We're winding down our SALT series in May, so everybody has the summer to take a break and get back into it in the fall. So today, end of year, I know Medicaid can be confusing and a little bit difficult, but I wanted to do an overview so that you have an overview of Medicaid, a little bit about it. So I brought in a couple experts that handle Medicaid situations quite often, and they can tell you a little bit about themselves. I do want to remind before we get started that since we are recording, you can put your questions in the chat box. And then I guess at the end, we can have an open discussion if need be. If we have some other questions and if you don't want to put them in the chat box, we can do that at the end. And for those who don't know me, my name is Patty Schramm. I'm the parent resource trainer for the SALT series. And just a reminder, next week before we get started, on May 23rd is our last session for SALT Talks, and we're going to be talking about special needs trusts and stable accounts. So with that, I am going to turn it over to Latosha, and I see Tammy is on as well. Latosha, I made you co-host, and I'll go ahead and find Tammy and put her on as co-host if needed.
Thank you, Patty, and thank everyone for coming today. I appreciate your time. My name is Latosha, and I work with Warren County Board of Developmental Disability Services, and I have Tammy Disney here as well. I'll let her introduce herself as well.
Yep, you're on mute.
Sorry. I'm Tammy Disney, and I'm the Benefits Analysis Coordinator with Montgomery County Developmental Disability Services. So I'm going to be just kind of here for answers and to answer some of your questions and to support Latosha. Thanks.
Thank you, Tammy. So today, as Patty indicated, we're just going to go over Medicaid. I'm going to review certain categories of Medicaid that we typically see our individuals eligible for. I won't go over all Medicaid categories because there's several different programs within Medicaid, and it'll be a long time to be able to actually discuss each category. So we're just going to commonly focus on the common categories that we see that our individuals served are typically eligible for. If you have any questions throughout this, let us know. And maybe, Patty, is it best to kind of just go through the presentation and wait for questions at the end? Okay, great. Awesome. All right, let me share my screen. All right, can everyone see my screen?
Yes.
Awesome. Okay, so today we're going to spotlight the age blind disabled Medicaid, home and community-based waiver services Medicaid, SSI Medicaid, 1619B Medicaid, and Medicaid for Medicaid buy-in for works with disabilities program. This is just a simple overview to show that there's several different categories, as I mentioned earlier, that Medicaid cover, but I wanted you guys to be aware that in addition to what we're covering today, there's other options available through Medicaid. So Medicaid provides healthcare coverage to children, adults, pregnant women, parents, seniors, individuals with disabilities, and individuals with low income below a certain income level. To be eligible for Ohio Medicaid, an individual must be a resident of Ohio, be a United States citizen, or meet Medicaid non-citizenship requirements. In need of healthcare assistance, financial requirements for Medicaid. Medicaid has a pretty nice little link here where you can check your potential eligibility for Medicaid benefits. I always share with people, even if you don't know, you're just unsure, apply. And the local JFS office will determine your eligibility. The first category of Medicaid we're going to discuss is called age blind and disabled. JFS, referred to as ABD Medicaid, is Medicaid coverage for older adults who are blind, disabled, with limited income and resources. To qualify, an individual must be age 65 or older, legally blind or disabled. In 2023, have countable income below $914 for an individual, $1,370 for a couple. The resource limit for this category of Medicaid is $2,000 for an individual, $3,000 for a couple. And these are highlighted links, since we're not going to have time to go through all the details, where you can click on these links to get more information regarding this category of Medicaid. The next Medicaid category we're going to cover is called SSI-based Medicaid. And this is Medicaid coverage for individuals entitled to supplemental security income. We always recommend, when you're approved for SSI, notify the local Job and Family Services of approval to confirm enrollment. We have been told with the Social Security office that if someone is not already on SSI, they're submitting an application for Medicaid benefits as well when they're going through the SSI application process. But it's very important to notify Job and Family Services as well, just to make sure you're in the system if you qualify for SSI, and they're actually working on their end to get your Medicaid benefits started. To maintain this level of Medicaid, you have to have resources under $2,000. There's additional information that you can receive under this link here. We're next going to cover the home and community-based waiver services under Medicaid. The waivers allow individuals with disabilities and chronic conditions to receive care in their homes and communities rather than a long-term care facility. The DD waivers consist of individual option waivers, and that's for all ages, level 1 waiver for all ages, and the self waiver, and that's for all ages, excuse me. And then there's a I don't know why I cannot say this word today. Psychiatric service waiver, excuse me, and that's the Ohio RISE waiver. I think that's been in place for a couple of years now. There's a little short video that I attached to the resource link where you can get additional information regarding that if you're unfamiliar with that. But you can also click on each category of Medicaid that I listed for the waivers to get additional information. There's nursing home level care waivers, that's the Ohio home care waiver, the passport waiver, and then the assisted living waiver. And each category, like I said, has additional information that you can click on to read more into each waiver. To qualify for the home and community-based waiver, you must meet the level of care required for the waiver. This year, have countable income less than $2,742, or if you do have excess income over that amount, you can open up a qualified income trust to set aside the excess income into that trust fund in order to maintain eligibility for Medicaid. Have resources below $2,000. The next category we're going to cover is called 1619B Medicaid coverage. And this provision continues Medicaid coverage for most working SSI beneficiaries. It provides continued Medicaid coverage at no cost if earnings alone or in combination with other income are too high to receive supplemental security income. In 2023, individuals can have annual gross earnings up to the threshold of $41,830 to be eligible for 1619B. To qualify, it's important to know that the individual no longer meet eligibility for SSI payment due to earnings, still have a disability and continue to meet Social Security definition of disabled, need Medicaid coverage, have resources under $2,000. And when I say need Medicaid coverage, so if Social Security is doing a review and they're asking about your need for coverage, it's important to make them aware that you need Medicaid coverage in order to continue to be eligible under Medicaid under this provision. The next category we're going to cover is called the Medicaid buy-in for workers with disabilities. The Medicaid buy-in for workers with disability program allows individuals with disabilities who are working to qualify for Medicaid coverage with higher income and resource limits and buy into Medicaid by paying a premium. Some people may not have a premium, just really depend on their income. To qualify, they must be a citizen or meet the citizenship requirements of Ohio, be between the age of 16 and 64. There is currently a push to raise that age limit. So hopefully legislation will pass where that will increase above 64. You have to be disabled, be employed in tax employment, and meet the financial requirements for the program. So for this year, you cannot have countable income above $3,038. Have resources under $14,318 for this year. Typically every year there's a slight increase. So this amount may rise next year. There may be a premium required depending on your income. And depending on your income, premiums are calculated based on income, family size, and other deductions. There's also a Medicaid category called MAGI Medicaid for adults, children, and families. MAGI stands for Modified Adjusted Gross Income. My MAGI Medicaid program is part of the Affordable Care Act. MAGI-based budgeting is used to calculate a person's household size, income, using the federal income tax rules, and a tax filer's family size to determine eligibility for the Medicaid for this particular Medicaid category. How to apply for Medicaid. So there's a couple different options to apply. You can always go online at benefits.gov to submit your application. If you prefer to do it in person, by paper, or by mail, that's an option as well, by visiting your local Job and Family Services office. I did provide a link here where you can download the actual Job and Family Services form to apply for Medicaid benefits. And then there's also a Job and Family Service locator I provided on a different sheet where you can locate your local Job and Family Services office. You can apply by phone by calling the Medicaid Consumer Hotline. There is step-by-step instructions online as well to help you with applying for Medicaid. So I provided that link for additional information on how to apply. Where to go for additional information regarding Medicaid. You can always call the Medicaid Consumer Hotline. There's a couple of links I provided here where you can visit this link to get additional information. And here's the Job and Family Services locators to find a local Job and Family Services near you. You can always contact your local county board as well. There is individuals within the board that can provide some support as well to help direct you on what needs to be done. Myself, Tammy with Montgomery County DD, there's Cindy with Greene County, Beth with Butler County. So there's someone that's identified in each county that can provide assistance as well, in addition to your SSA or transition coordinator that can provide some support too, or direct you to the person that can provide you with the support that you need. Here are some resource links for Medicaid. Excuse me. I really think this Medicaid eligibility tracker is really a good resource to look into if you're just not sure. Also provided a link where if you're looking to see if you are eligible for any services provided through Job and Family Services, like cash, food assistance, in addition to Medicaid assistance. Here's a link where you can find out information to know what you need to know when you're applying for Medicaid. This is a great link that discusses the home and community-based waiver. This one discusses Ohio Rise. And this link here is DB 101, which is a great resource too regarding different benefits that's available to individuals with disabilities and how working may impact their benefits. And Patty, how are we on time?
Great. You guys still have 15 minutes.
Okay, good. I was trying to run through it, but not go too quickly. So if it's okay, I'm gonna open this link right here because I think it's a great resource. And it kind of take you through the stage of someone that is graduating high school and how a home and community-based waiver can assist them. So let me get that uploaded. I think I'm gonna have to go to another screen though, because sometimes under remote, it doesn't.
Did you check the two boxes when you shared your screen? There's a lower left two boxes if it has like for when there's sound or anything.
You know what, Patty? I don't know if I did or not. Let me see if it'll work.
Okay.
While you're doing that, why don't I do one of the questions? Somebody said something about my son sees a physician who doesn't take insurance and expects to be paid on DOS. I'm not sure what DOS means. He does provide paperwork to submit the bill to our primary insurance. Is there a way to submit the remainder to Medicaid? If so, please tell me how. So in order to have Medicaid pay for any type of medical services, the doctor has to have a contract with Medicaid in order for Medicaid to pay. So I don't believe that there's any way that you can have Medicaid pay if he sees a doctor that doesn't have a contract with them. Same with the hospitals and specialists and that kind of stuff. They have to have a contract with them. There are separate different types of Medicaid. There's some HMOs, there's CareSource, Molina, Buckeye, Paramount, and United Healthcare, and those are HMOs. So sometimes the doctors may have contracts with a certain HMO, and if you don't have that HMO Medicaid, then you may not be able to see those doctors. So it's real important when you're choosing, once you do get Medicaid, if you choose an HMO, to make sure that they accept the doctors that you're seeing and specialists that the individual is seeing accepts that form of Medicaid.
Thank you, Tammy. Is there any other questions that are listed before I start the video?
Nope, go ahead. No, sorry.
Programs.
There you
A Griffin Hammis production tailored for Ohio.
I just finished high school. Yay! And I want to live an adult life now. I'd like to get a job, maybe as a scientist, and move out of my parents' house. But I'm gonna need some help. I just don't know where to start looking.
Congratulations on finishing high school. It's great that you want to work and move on from your parents' home. To get help, have you heard of Medicaid waiver programs?
I think I've heard of Medicaid, but not waiver programs. What are they?
A Medicaid waiver program gives people with disabilities the help they need to live and work in the community instead of in institutions.
That sounds like something I could use. How do they help people?
That depends on which Medicaid waiver program a person uses. In Ohio, there are a number of programs. 3 of them are for people with developmental disabilities.
What's a developmental disability?
It's a disability that started before you turned 22 years old that causes you to need help to live and work independently.
That sounds like my disability. So, what are the 3 programs that might help me?
They're called Individual Options, Level 1, and Self-Empowered Life Funding, or SELF. Individual Options, called IO for short, is a good fit for people who need a lot of help or many different kinds of services. Level 1 is a good program for people who don't need much help from paid staff. Usually, people who use Level 1 need help with only a few things, or they have help with some of the things they need from unpaid people like family, friends, neighbors, and coworkers. And SELF works well for people who want to be in charge of some of their services. SELF lets you or someone you choose be in charge of hiring and training the people who provide your services and to manage the budget for your services.
I think at least one of those programs could work for me. Can anyone with a developmental disability get into one of those programs?
Not everyone. You have to meet 3 requirements. You need to have a developmental disability that affects your ability to live independently. You must need at least one service offered by the Medicaid waiver program, and you need to qualify for Medicaid.
So I do have a developmental disability, and I do need services. I don't have Medicaid. Is there a way I can get it? I'm not even exactly sure what it is.
Medicaid is state government health insurance. It pays mostly for medical services, but in Medicaid waiver programs, It also pays for services you need to live and work in the community. There are lots of ways you can get Medicaid if you have a disability. For example, if you get supplemental security income, called SSI for short, which is a cash benefit for people with disabilities who don't have much money, then you automatically qualify for Medicaid in Ohio. If you have too much money to qualify for SSI, like if you get too much SSDI, you might qualify for Medicaid in a way that's just for people in Medicaid waiver programs. And if you don't get SSI but you're working, you might be eligible for Medicaid through the Medicaid Buy-in for Workers with Disabilities, or MBIWD. There's another video about MBIWD on this site. To learn more about how you can qualify for Medicaid, go to benefits.ohio.gov.
Well, I applied for SSI. You mean if I get approved for SSI, I'll get Medicaid along with it?
That's right. And then you'll meet the third requirement to get into a Medicaid waiver program.
Okay. Is there an age limit for Medicaid waiver programs?
No, you can be any age and qualify.
So, if I get into a Medicaid waiver program, what kinds of help can I get?
You can get lots of different services. The IO, Level 1, and SELF programs all offer homemaker and personal care services to help you with chores around your home and hygiene, help to get and keep a job, transportation, special technology and equipment, and respite care to give you help when your regular caregiver is not available. Some of the programs can give you other services too, like help managing money, home-delivered meals, sign language interpreting, help to manage the services you receive, and more.
Wow. Would I get all those services?
Not necessarily. You'd get a service plan that described your needs and choices and listed the services that would provide the help you need. You'd get at least one service and maybe a number of them, but probably not all the services.
Okay. Then how do I apply?
Contact your County Board of Developmental Disabilities. To find your county board, go to dodd.ohio.gov. Click on Supporting You and Your Family, then click on Contact Your County Board. Your county board will help you get services you need, especially to meet the needs you have right now. That might include help from local agencies, county board funds, regular Medicaid services like home health care, unpaid help from people you know, and Medicaid waiver programs. It's important that the county board will help you get services in different ways, not just Medicaid waiver programs. That's because Medicaid waiver programs have waiting lists. You might be able to get some of the help you need in other ways if you can't get into a Medicaid waiver program for a while.
Let's say I get into a Medicaid waiver program. Do I have any say about what kinds of help I get and who I get it from?
You sure do. Your own choices help to guide which services are included in your service plan. And you can manage some of your services. All three of the programs let you have control over the homemaker and personal care service. And the self waiver lets you control most of your services.
How would I control my services?
Good question. You can decide how much control you'll have. You might want to only choose how much of the money in your service plan to spend on each service. Or you might decide to be the boss of your services by hiring the people who will help you, training and supervising them, deciding how much to pay them, making sure they do a good job, signing their timesheets, and handling written records and paperwork.
Whoa, I've never been a boss before. I don't think I could do all those things.
You wouldn't have to do them all by yourself. You could have a family member or friend help you, and you can get a professional to teach you how to do some of the tasks or do some of them for you.
That sounds great. But there's one more thing I'm wondering about. I want to get a job. Can I still get help from a Medicaid waiver program if I have a job?
You definitely can. All 3 of the programs offer services to help you get and keep a job. You're not only allowed to have a job, you're encouraged to.
This is great. I think I'm ready to get started. So, how do I apply again?
Just contact your County Board of Developmental Disabilities. You can learn even more about Medicaid waiver programs at dodd.ohio.gov. Click on Supporting You and Your Family, then click on Waivers and Services. To see more videos like this one, go to oh.db101.org. Knowledge is power. Take time to learn more about Medicaid waiver programs.
I just love that video. It takes you through the different options for the waiver and how an individual can take advantage of waiver services. And I know not everyone would be eligible for a waiver, but that is some good information to know if you have someone that you're working with or your loved one is entitled to a waiver. Kind of explain briefly the different waiver services that's available under the Medicaid program.
And you'll be sending this, Latosha's going to be forwarding me this presentation, which I'll be uploading to the Google Salt Drive and to the Live Binder. So then you'll be able to click on all those links and re-listen to that video and any of the other items that were in that presentation.
Patty, was there any additional questions that maybe I overlooked or didn't see?
Looking here. No additional questions. We had just for our, we had Medicaid, and then I had a Medicaid buy-in. I had a small, our son had a small copay. Is that the term I went, what was it?
A premium.
Premium, that's it.
Yeah.
Trying to come up with, yeah, we had a small premium every month for when he had a job and he got the Medicaid buy-in, but we had to fill out paperwork for that. So, all good information.
And sometimes I see with, I'm sorry, go ahead, Tammy.
Yeah, the Medicaid buy-in, they haven't collected the premiums for several years, but they are getting ready to collect those premiums again starting in August. So if you are on Medicaid buy-in for workers with disabilities with a premium, once you have your renewal this year or next, you will have to start paying a premium again. So just putting that out there.
Good to know. Good to know. Are there any other questions for Latosha or Tammy? Again, if you contact your county board, your SSA, if you don't have one, you can find one. You can find the county board near you at the DODD site that they had mentioned. A lot of that Benefits 101, I have that in the live binder, that website link as well. Is there any other questions out there? There's one. Does Medicaid become the primary insurance if the person has other insurance?
So Medicaid is payer of last resort. So if there is another form of insurance, that always is primary, and Medicaid always just picks up usually the whatever that insurance doesn't cover. But the first insurance is usually private insurance, Medicare, and then Medicaid is secondary or third sometimes.
And also to note, if you have an individual or your child or someone is receiving Medicare services and they become eligible for Medicaid, please let them know to reach out to Job and Family Services so they can get assistance with their Medicare premiums. And that will be under the Medicare Savings Program.
Is there any other questions before we wind down the meeting, before we wind down the session? I want to thank Tammy and Latosha for going over. This is not an easy topic. There's a lot to it. And to do it in a half an hour and give you the links, they will be able to look at some of this, the links on your own, review the presentation. But it's a pretty detailed topic.
And just keep in mind that individuals, when they go and apply for job and family service, when they go apply for Medicaid with Job and Family Services, the Job and Family Service representative is going to look at every category of Medicaid that an individual could be potentially eligible for to make determinations. So you don't always have to go in and say and know which category of Medicaid that you want to apply for. On the application, you just want to check Medicaid or medical assistance, and they'll run through the process to determine which category of Medicaid that you might be eligible for.
There is a question about a phone number call if there's more elaborate questions. You know, if they want to elaborate a little bit more, if there's something specific.
Yeah, they can call any. Is there, like, you can call Medicaid, or you can call myself or Tammy, and we can discuss.
Can either of you put your email or a phone number are able to put that in the chat so they can reference that? There you go. So if you have any questions or you think of one after this, like we said, reach out to your SSA, contact your county board, you know, Job and Family Services, or you can reach out to these two. There should be a Tammy and a Latosha in many of your counties. You mentioned Butler was Elizabeth Reisner. And then there's Greene County is Cindy Nava. So if those aren't your counties, you can just, we can, you know, one of us could look it up for you, or, you know, put you in touch with someone from your county as well.
Right. We have contact information, at least for the surrounding county. So if you reach out to us and you're with another county, we can give you the direct contact for the county that you need to reach out to.
All right. Very good. Is there any other questions, or I think you got, yeah, I think we got all the questions that were in there.
Oh, Patty, I should have mentioned early on, and I'll send you the link, but there is going to be a more in-depth presentation on the Medicaid buy-in for workers with disabilities program for Fear Factor, June 28th. And I can send you the link to that to share with everyone.
Is that a daytime, evening, or?
It's daytime. I believe it starts, if I remember correctly, 1 o'clock, and it runs for about an hour or so.
Okay. I put June. So if you have the link, you can just throw it in the chat box there. We did post that. I think Elizabeth had given us, Beth Reisner had given us the information, and I did post it in our Facebook at one point. Okay, 1 second. Well, I'm going to go ahead and stop the recording. 1 second. Thank you again, ladies, for your presentation. And let me close that recording.